It's always in one of those moments where you actually realize that you started something and you stopped doing what you had started. And then you realize that, oh, there's this thing that I had started that seemed to be doing good, but I sort of stopped. So I actually was going through my channel and actually watching some of the videos. Audio wasn't so bad, but lo and behold, we're making improvements, we're making progress. Welcome to Hospital Survival Guide, Season 2, finale. Grab a piece of paper and let's go. Hello and welcome to Hospital Survival Guide, Season 2, finale. This is, of course, a series on my YouTube channel. We'll look at hospital-related things. We'll look at pretty much how to survive in the hospital for those that are recently graduated, those that are doing their junior residency, and those that have just completed the junior residency. In this particular video, I have been thinking about a video idea, probably what to do. And you know, it's always that time when you're just like in the bathroom, on the toilet seat, and you're just thinking, and you get hit by a brilliant idea. I'm not saying I was in the bathroom, by the way, or I was in the toilet. I know that's quite highly specific, but I had this idea and I was like, why shouldn't I do a video about choosing specialties? So it will sort of be like a blend of how my experience was during junior residency, and now that I'm about to jump into specialization, what do I want to do? What do I want to avoid? Where do I want to be? That kind of stuff. And depending on where I am right now and the nature of the work that we do in the emergency department, for those that already don't know, I've been in the emergency department now for quite some time. So I thought of putting together this particular video to help someone who hasn't yet started rotations, someone who hasn't yet started junior residency, so that you can look out and then you decide that obs and gyn, nope, it is not for me. So grab a piece of paper and let's talk about how to pick the right specialty. So, as you already know, once you finish your medical school after 6 years now, I think medicine is in 6 years. I think very soon you'll just be hearing people are doing medicine in 5 years. It's not, things are changing and we're actually progressing to the newer standard. So after doing your medicine for 6 years, you're going to be required to take the licensure exams. Everyone has to take those now, whether you're trained outside, whether you're trained inside. Everyone gets one. You get one. You get one. You get one. You get the point. Everyone gets one. So in terms of the licensure exams, once you pass that, you're going to be now registered as really, you're going to be a doctor, yeah, but you won't have a full practicing license, meaning that you can't work outside the government facilities, accredited internship sites. You can't leave the country. So after now you get your practicing license, after of course you've passed your HPCZ exam, that's another story for another day. You're now going to be subjected to internship, or what we call junior residency. You don't want to be referring to it as internship, you want to actually be referring to it as junior residency. We are going to be rotating in various departments. Obstetrics and gynecology, we're going to be dealing with pregnant women. You obviously already know that if you're watching this video. Pediatrics, we are going to be dealing with children and adolescents, as well as internal medicine, we're going to be dealing with adults, and surgery, we're going to be dealing with surgical conditions, people that require to be taken to the operation theater, or certain conditions that are strictly for surgical cases. So internship now has been reduced. I know it has a lot of controversy and I'm not going to dive into that, but as of this year, beginning of this year, the duration of internship, whether you were trained outside the country, whether you're trained within the country, it's now the same for everyone. They're doing internship for 1 year. So meaning that you're going to be doing 3 months in each department. 3 months in obstetrics and gynecology, good luck though. 3 months in surgery, which I think is sort of doable. 3 months in internal medicine and 3 months in pediatrics. So 3 months in internal medicine and 3 months in pediatrics, I think it's quite doable. And it has its advantages and disadvantages really, depending on where you're actually doing your internship. Because I hear those that are doing internship at these level 1 facilities, they get to see a lot of people. So imagine you're stuck in surgery, for example, for like 6 months. Then you see a lot of cases. Moreover, when you're on call, it's not like you're just segregating to see patients that are in surgical departments, because you're seeing everyone, because you're sort of being exposed to the system. A bit different from the tertiary facilities where you're just in surgery. If you're on call days, you're just seeing surgical patients. So again, is that debate about who is actually getting more based on internship. And it's not a video based on where you should do your junior residency. If you do want me to do such a video on the channel, please comment in the section below that please do a video on internship sites and how to go about picking the right internship site. but this one is more about specialization. So many people always ask me, what do you want to specialize in? And I always just like to troll them, and I'll be like, I want to do obs and guide. And everyone will just be looking at me like,
ugh. Brother, ugh. What's that? What's that, brother?
So I like to troll them and say that I'm going to go into obs and guide, because everyone knows that when I was in obs and guide, I was tired all the time. I used to complain all the time. But actually, in retrospect, when I look at it, I actually had a great time. Sort of like that ex that you keep going back to. Like, you don't know what it is, but you keep going back to this particular ex, if you know what I mean, yeah? I'm sure you know what I mean.
Yeah,
you don't?
boy.
Okay, fine, fair enough. So it depends. Your specialization and your drive to where you want to go to will depend on what you were doing as a student. It will depend on what you were doing as a junior resident when you are deciding on which specialty you want to go into. So I will start with the surgical departments because, yeah, surgery, obs and gyne, okay. Anyways, it will not be a video where I'm discouraging people to go for certain specialties, so I'll remain as impartial as possible. I will try, please, I will try and remain as impartial as possible. So let's begin first of all with the mother of all things, obstetrics and gynecology.
Stop the cap.
Because we love our women and we all wouldn't be here because of women. But if you actually think about it, if it was just women alone without men, how would the women get pregnant though? I know. Anyways, I don't want to start a big fight on my channel, but we all love our women and they are quite fundamental to the prospect and the survival of our society. So in terms of obstetrics and gynecology, now that the obstetrics and gynecology rotation is roughly 3 months, it means that you have to learn a lot of things very, very quickly. Big heads up, obstetrics and gynecology has a lot of, especially if a mother is unsubscribed to life or is unalived, there's a lot of talking, that is a lot of politics in obstetrics and gynecology. So pretty much if you are a person who can easily defend yourself, you're a person who can easily put your point across that I was doing this and this is the right thing, this is the right way to manage these patients, then generally obs and gyne is for you. It has a lot of surgical skills that you require to learn. So knot tying, how to do certain procedures, how to do certain maneuvers during delivery and all that. Is a very beautiful department, especially the obstetrics department. Very beautiful. You'll learn a lot of things. You'll learn a lot of tricks and perks. That's how you can actually speed up labor a bit, how you can augment labor a bit. If those things give you adrenaline, if you're an adrenaline junkie, obs and gyne is for you, because there's so much adrenaline that you actually go through in terms of the obstetrics department, to be specific, because you're running up and down. A woman is screaming in this room, another woman is screaming over there. There's a baby that's about to pop up over there. There's another baby that's about to pop up there. The student is rushing to tell you that, oh, there's a woman that's about to deliver. The midwife is also calling you over here. So there's a lot of chaos that's happening, and some people love that chaos.
Loving you too much.
When you start the rotation, it sort of feels like as if you're drowning, especially if you haven't been exposed to such an environment. If you missed quite a lot of this as a student, it becomes quite overwhelming when you actually jump into it as a doctor, as a junior resident. But obs and gyne, if you're an adrenaline junkie, especially obstetrics, very good for you. If you're good with your hands, good surgical skills, good people relationship, like basic people relationship, but of most importance, patience. Because there's a woman that will try your patience, especially the pregnant one. We all know how every woman is. I'm not going to point that out, but especially the pregnant one. And the ones that are very young, the prime gravidas that are very young and they're in labor, you really need a lot of patience. So obs and gyne is something that needs quite a lot of patience for you to do. So if you do have patience, I think it's for you. You need a good surgical skill. In terms of surgical skill, I could say maybe 4 out of 5 minimum surgical skills. In terms of people interaction, you need maybe about 3 out of 5. In terms of patience, you need 5 out of 5. So in terms of the theory section, and possibly even in terms of learning the information that is there in obstetrics, it's very limited. There are very little conditions that you can actually learn. Like pretty much, if you're coming fresh off from school, you can literally like read them in about a week's time and finish all the conditions in specifically obstetrics. It's a bit different when it comes to gyne. In terms of gyne, you need to actually learn and have a good surgical skill. I think the surgical skill that you need in gyne is about 5 out of 5 compared to obstetrics, which is a 4 out of 5. But you need also a lot of patience, especially women coming in with a lot of these gynecological problems. Maybe they've seen a lot of doctors. Some of them tend to nag quite a lot. Some of them tend to be very persistent. Some of them tend to be quite apprehensive. So you need a bit of more people talking skills, and you need a bit of more public relations. So I could say in terms of the people talking thing, 4 out of 5. But in terms of the theory though, gynecology is like now the medicine for women. So in terms of gynecology for the women, it's like medicine for women. So it also has a much greater depth. There's a whole lot more reading. So in terms of the theory, I can say it's slightly a bit more challenging compared to the obstetrics section. So I can say maybe 3.5 stars because there are harder things in this lifetime. But if you want something that will make you a lot of money, something that is gives you quite a lot of adrenaline, something that gives you that sort of job satisfaction to bring life into this world, then obstetrics and gynecology is for you. And if you don't enjoy reading quite a lot, obstetrics and gynecology is for you. Now, moving on to the other surgical specialty, which is surgery. Now, if you want to do surgery and you want to be a surgeon, and I'm sure if you've watched A Good Doctor, I want to be a surgeon. Everyone wants to be a surgeon because of The Good Doctor. I don't want to be a surgeon anyways. So in terms of surgery, again, it depends on what kind of specialty you want to go into in terms of surgery, because remember that different brands of specialty. There's neurosurgery, is a bit more complex, needs a lot of delicacy. You need to have a very steady hand. You need to have very good surgical skills in terms of neurosurgery compared to something like, let's say, abdominal surgery, which also needs a bit of some dexterity, but not as much dexterity as with the neurosurgeons. Maybe we should get a neurosurgeon and a general surgeon on this channel. But anyways, it's for the perception that I have based on what I have observed. So I think it also depends. If, for example, uro also needs different skill set, orthopedics also needs different skill sets. But generally also surgery is also, I think, for adrenaline junkies, especially on the core days when they receive a lot of these emergencies and they are in theater. The only thing that surgery needs is strong people, strong men and strong women to actually drive the department. If you're not a strong person, if your will to live is not a good thing, then surgery is not your thing. You need to be able to stand firm, especially when dealing with the other professions, the scrub nurses, the anesthesia department, because there's a lot of that back and forth and a lot of that friction. I'm not going to lie. In terms of obstetrics, there everyone fears, because if someone goes wrong, people just keep shifting blame, and we know that a woman is not supposed to die in labor. Pregnancy is not a disease. But in surgery, you have to fight people. So I think in terms of people skills, you need a 5 out of 5, because you have to fight a lot of people when it comes to surgery and it comes to them actually even doing their jobs. Not that I'm trying to shame anyone, it's just the nature of things, because sometimes you may get a myriad of cases. For example, I remember there was one time when I was in surgery where we had like 3 intestinal obstructions, 3 sigmoid volvuli. Pronounce a plural of sigmoid volvulus. Sigmoid volvuluses? Volvuli? I think volvuli sounds right. But anyways, we had a lot of those cases, a lot of intestinal obstruction due to sigmoid volvulus. So we had about 3 of them. And you know how long that procedure takes for you to do the resection and the anastomosis. It takes a while. So again, you reach a point whereby, and it was just common with our code day. On our code day, we had a lot of amputations. We had a lot of intestinal obstruction. They even knew us that when it's this type of firm that is coming on call, you'll work in theater. So there's that thing. There's a lot of standing, there's a lot of working, but in terms of job satisfaction, there is a lot of job satisfaction. Not as much adrenaline though as compared to obstetrics and gynecology, but definitely more reading as compared to obstetrics and gynecology. So if you're a person that hated anatomy, surgery is not for you, because there is a lot of anatomy that you need to learn, a lot of the surgical skills that you need to learn, depending on which specialty you want to do. Again, if it's a general surgery, if it's a cardiothoracic surgeon, if it's neurosurgery, if it's uro, there is still that base anatomy that you have to learn. Of course, they will teach you during specialty, or you will teach yourself, because they don't teach in terms of postgraduate studies.
Be careful.
Like, yeah, they do guide you along the way, but it's different from undergraduate where there's a lot of spoon feeding in undergraduate stuff. But postgraduate stuff, as you're preparing even the exams, life was hard, guys, but it's not, trust me. So if you love the adrenaline to some extent, but not too much, you love cutting and fixing things, surgery is for you. Not that much reading compared to the other medical specialties. Again, you may not even see a lot of deaths. Now, if you don't deal so well under pressure, the surgical departments are not for you. Surgery is not for you. Obstetrics and gynecology is not for you, because when certain things do happen in this department, you need to act there and then. And when these things have intensified and let's say a patient has died, then things hit the fan. And there's a lot of blame game, there's a lot of finger pointing. Some people have even quit these departments to go to other places that are less toxic. So having said that, let's now segue into the medicine departments, which is where all the land of milk and honey and joy is. I'm only joking. But beginning with pediatrics, the little babies, the little ones. Again, there are different branches of pediatrics, just like with internal medicine, there are different branches. So you could be a neonatologist, you could be a pediatric nephrologist, you could be a pediatric oncologist, you could be a pediatric respiratory doctor, I don't know what they're called, but there are different sections that you could be, or just generally do general pediatrics. So if you are in pediatrics and you're wanting to do pediatrics, you should know that have a lot of patience. I think even 6 out of 5 patients, because children need a lot of patience. They need a lot of love. So you should be someone who enjoys being around children. You should be someone who enjoys interacting with children. So your people skills must be 5 out of 5. In terms of information, it is a lot. Trust me. It's like a mini version of internal medicine, but in kids and with its own conditions in addition to the conditions that you have already in adults. So it's like even more reading and a lot of details. So you need to have a lot of details. You need to be someone who's very, very observant. Because remember that a child is not going to tell you, my tummy hurts. Small babies are not going to tell you, I'm having a headache. They're not going to tell you, I'm not able to see very well, unless the older children. So those very, very small ones, generally you need to have a good eye to see certain things. You need to be patient. You need to be quite observant to picking out these cues and some of these things as they are happening. In addition to this, in terms of the people interactions, you have to have a lot of patience for the people that you're interacting with, because it's a stressful moment for them. It's a stressful moment for the parents. It's a stressful moment for the caregiver that is there. So they may even fight you. They may even slap you. In terms of job satisfaction, I think it's rather a delayed type of job satisfaction when the child gets well slowly over time, because there are very few conditions where you institute management there and then the patient just surprisingly gets better. So there's not much adrenaline that is there. It's just that you're going to get a lot of flus from children that don't go away. And lo and behold, my flu is actually healed. And my voice is okay now. I'm no longer coughing. So that is good. But that flu that you get from pediatrics, so if you're aiming to specialize there, in terms of the theory, it's quite challenging. I can't say that it's easy. It's quite challenging. There's a whole lot of information that you have to learn. So I can give it a 4.5 out of 5. In terms of the job satisfaction, not so much, maybe like a 3 out of 5. In terms of the people and the patients, maybe a 5 out of 5. And of course, if you are a person that hates seeing children sick and hates seeing children die and you hate noise, pediatrics is not for you. And maybe I'm one of those persons. I really like pediatrics, but the only thing I don't like is seeing children sick and seeing children die. That's the only reason why I wouldn't actually want to do pediatrics. But if I had the chance to do both pediatrics and something else, I will tell you at the end of the video, I will do pediatrics and something else. But quite unfortunate, that would be like 8 years of my life, and of which these 8 years I need to also progress in life. Then we'll come down to the best of the best, the cream of the cream, the creme de la creme, internal medicine. So this is where now you'll be arguing with people about why the concentration of potassium is 4.8 and not 4.4. There's a whole lot of minute details that you need to know. My registrar once told me that, Akazevo, Why do you want to come to internal medicine? There are easier things in life. There are easier things in life where you can even make more money. So internal medicine is quite challenging. There's a whole lot of details that you need to learn. Like, guys, I thought I was okay. Like, I thought I was okay with the base knowledge that I had after finishing internship and having a bit more depth in terms of reading, until I met certain other registrars and senior registrars. And I was like, I am very far from where I need to be. I am very far. There's still a whole lot of information that I need to learn. And the thing is that you keep reading and you keep discovering new things, and it's like you're falling, and you're not hitting the ground. You even get tired and you're like, when am I going to hit the ground now? But still you're falling and falling and falling. It feels quite immense. Looking at the papers, the exams, and how they are set, the theory exams, they're asking you a question when they actually already even tell you the answer, and they ask you what else, something that you didn't even expect that they would ask you, certain details, certain basic to small things. Imagine postgraduate exam and someone is asking you to draw the conduction system of the heart. I don't think you would actually even suspect that or expect that in a final exam, but something that's so basic, but yet it's something that if you are like really focusing on learning the greater details in terms of internal medicine, you wouldn't really focus on. So again, you would ask yourself, there are a lot of things that need to be done in terms of this particular rotation, in terms of learning this. And of course, the books are very thick. Apparently, when you want to become a physician, you need to read that Harrison textbook about 3 times. And the Harrison textbook has volumes, each of them with at least over 1,000 pages. So that's roughly about 4,000 pages, and you have to read that book 3 times. When are you going to take the time? When are you going to have the time to actually go out and make kids? When are you going to have the time to have fun? So internal medicine is very, very hectic in terms of the information. I'll give it a solid 5 out of 5 if you want to specialize in internal medicine. It's a very challenging thing. I think it's the most challenging specialty to actually go into because of the bulk majority of the information you have to learn. It's unlike the surgical departments, because once you learn the surgical skills, maybe there's a few variations here and there. You incur a few problems in theater here and there, but generally the base skill remains the same. It's unlike with theory knowledge, where today, if I discover that a certain tree cures malaria, name it after myself, they start studying it quite extensively, then it's new information. And if it's working better than the drugs that are already there, it means that that information now becomes old, and this information I've discovered becomes new. So there's a lot of information that gets discovered every minute, and you have to be up to date each and every single day. You could be reading a condition today and have like management of this condition today. Then tomorrow, that management becomes obsolete. There's no drugs that are being formed. In terms of people, there's a lot of patients, and you need to have a good interaction with people, because you'll be stuck with certain patients that are chronic for a very long time. So for some months and all that. So it's a bit difficult sometimes if you don't have good people skills. And then of course, you need to develop a thick skin and have an elastic heart. I know what you guys are thinking. I'm not talking about the soul, but you need to develop a thick skin, because there's a lot of shouting. There is a lot of this looking down upon from especially certain consultants, certain seniors. There is a whole lot of expectation that is put on your shoulders. So you need to have the patience to deal with people. You need to have the patience to deal with your patients. And remember, these are patients you're keeping for a very long time. So there is very little or minimal job satisfaction, because most of your patients are chronic. You don't see the almost instant impact rather, compared to surgery and obstetrics, so you can actually do something there and then. But it's a bit different in terms of internal medicine, because the job satisfaction is a bit slow. But of course, when patients do get better, well and good. Biggest disadvantage for internal medicine, to be specific, is a lot of patients die. So it's very easy, especially if you're an empath, to become depressed. It's very easy to actually be burnt out in terms of internal medicine, because of the sheer number of patients that you're seeing, the sheer number of patients that are dying, the amount of knowledge you have to learn, how the seniors are making you feel, how the patients are making you feel. It just feels like as if you're overwhelming. But overall, if you're someone who likes the challenge, you're someone who wants to learn as much, you're someone who's a curious soul, internal medicine is for you. And that wraps up this particular video on choosing the right specialty and the season finale. I know you guys enjoy these videos. If you do enjoy them, consider subscribing to the channel. Hit the bell notification icon so you never miss on such amazing content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.